Vitamin D deficiency is one of the most overlooked yet widespread conditions impacting seniors today, and its consequences for muscle health are far more serious than most people realize. While commonly associated with bone density and calcium absorption, vitamin D plays an equally critical role in muscle contraction, strength, coordination, and even recovery. It is not just a vitamin. It functions more like a hormone in the body, acting on receptors throughout muscle tissue. Without sufficient levels of this fat-soluble nutrient, muscles begin to weaken, subtly at first, but then progressively and sometimes dramatically, especially in the lower body. Seniors may notice increased fatigue in their legs during simple tasks like walking upstairs or getting out of a chair. Over time, this deficiency contributes to sarcopenia, the age loss of muscle mass that leads to frailty, poor balance, and increased risk of falls. But here's the biological root of it. When vitamin D is low, calcium cannot be adequately transported into muscle cells to facilitate contraction. This impairs both voluntary movement and postural stability, and the neuromuscular junction, the critical communication link between nerves and muscles, becomes dysfunctional. This is not something that happens overnight, which is why many seniors don't even realize they are deficient until the physical signs are already setting in. They simply feel weaker, tire faster, and start relying more on others to do what they used to handle effortlessly. What complicates this even more is that vitamin D synthesis declines sharply with age, even under the same sunlight exposure. The skin becomes less efficient at producing it, and on top of that, many seniors avoid the sun altogether due to skin cancer concerns, immobility, or institutional living. Factor in medications such as statins, steroids, and anti-seizure drugs, all of which further deplete vitamin D, and you have a recipe for silent muscular generation. And unfortunately, most doctors only test for calcium levels or assume dietary intake is enough, which leads to the false conclusion that everything is fine. But dietary sources like fortified milk and cereals provide only a fraction of the needed D3, and without consistent sun exposure or supplementation, the body falls into deficiency over time. Additionally, excess body fat, which is common in older adults, sequesters vitamin D and renders it biologically inactive, which means even blood levels may not reflect what's actually available to muscle cells. The consequence of this depletion is not just weaker muscles, but also reduced coordination and delayed reflexes, making daily life more dangerous and exhausting. Many seniors report frequent falls, leg cramps, muscle stiffness in the morning, or difficulty regaining their balance, and often no one connects it to their vitamin D status. Even more concerning, the connection between low vitamin D and mitochondrial dysfunction is now being explored, showing that deficiency may not only weaken muscles, but also impair their ability to generate energy efficiently, leading to chronic fatigue. The good news is that this decline can be halted and even reversed when seniors begin restoring optimal levels of vitamin D3, preferably in combination with vitamin K2 and magnesium. Many experience noticeable improvements in muscle strength, endurance, and postural stability. The K2 ensures that calcium goes to the bones and muscles where it's needed and not into the arteries, while magnesium acts as a cofactor for vitamin D metabolism and also supports muscle relaxation. Most experts recommend 2,000 to 5,000 IU of vitamin D3 per day for seniors, depending on body weight, existing levels, and sun exposure. But this should always be guided by a health professional through regular blood testing. Ideally, 25-hydroxy vitamin D, 25-OOG, levels should be maintained between 50 80 m/ml for optimal muscle function and systemic health. For seniors, correcting this deficiency is not just about maintaining strong legs. It's about preserving independence, reducing fall risk, improving energy, and enhancing quality of life. When muscles are weak, everything becomes harder. Cooking, cleaning, walking, bathing, even standing in place. But with the right levels of vitamin D, the body regains a critical piece of its natural foundation for strength, balance, and resilience. Restoring this one nutrient could be the turning point many seniors have been searching for and the first step toward feeling more in control of their mobility and vitality again. Vitamin B1, also known as thiamine, is one of the most overlooked yet foundational vitamins for nervous system function, especially in seniors. While it's often brushed aside as just another B vitamin, the reality is that thiamine acts as a key to unlocking the nervous system's ability to send and receive signals efficiently. Every time your leg moves, your foot feels the ground, or your muscles twitch involuntarily, it's your nerves and muscles communicating through tiny electrical impulses. And thiamine is what fuels that process. Without enough thiamine, this electrical communication begins to break down. It becomes static, misfired, delayed, or simply blocked. This is why thiamine deficiency often shows up first in the legs and feet with symptoms like burning, tingling, numbness, heaviness, and even cramping. These are not just random signs of aging. They are clear warnings that your nervous system is not getting what it needs. The problem intensifies with age because seniors are more prone to thiamine depletion than younger adults for several reasons. First, absorption in the gut decreases due to lower stomach acid and reduced enzyme activity. Second, many common medications prescribed to seniors, including diuretics, metformin, and blood pressure medications, rapidly deplete thiamine from the body. Diuretics flush out water-soluble nutrients like B1, while metformin, used by millions for diabetes, has been shown to interfere with B vitamin status, including thiamine and B12. The result is a body that looks like it's getting enough nutrients from food on the outside, but is silently starved of the vitamins that run the internal machinery. And when thiamine levels drop, nerve function suffers, leading to muscle weakness, imbalanced pins and needle sensations, and even fall. What most people don't realize is that thiamine is essential for glucose metabolism inside the cell. Every nerve cell in the body relies on a fuel-burning process to generate energy called ATP, adenosine triphosphate. Thiamine acts as a coenzyme in this process, especially in the pyruvate dehydrogenase complex, which is a key step in turning glucose into usable energy. If that process fails, energy production crashes, especially in high-demand areas like the brain and peripheral nerves. This is one of the reasons thiamine deficiency is linked not just to peripheral neuropathy, but also to fatigue, mental fog, memory problems, and even neurodegenerative disorders. In fact, a well-documented condition known as dry beriberi is caused by thiamine deficiency and manifests almost exclusively as nerve dysfunction in the legs and arms. Burning pain, weakness, muscle loss, and a numb sock sensation that makes walking difficult and sleep restless. Now here's where it gets even more interesting. Most standard thiamine supplements don't work well in seniors because they are water-soluble and poorly absorbed, especially in those with digestive challenges or chronic inflammation. The better alternative is a fat-soluble form of B1 called benfotiamine, which has been shown in numerous studies to dramatically improve symptoms of neuropathy, especially in diabetics and the elderly. Benfotiamine can penetrate the lipid layers of nerve tissue, getting to the root of the problem rather than just floating through the bloodstream. This form not only helps restore nerve signaling, but also reduces oxidative stress and supports nerve regeneration, something water-soluble thiamine struggles to do efficiently. Another critical point is that stress burns through B1 rapidly. Seniors who are dealing with chronic illness, worry, sleep disruption, or blood sugar swings are unknowingly accelerating their B1 depletion. Combine that with a typical senior diet that often lacks nutrient density, and you've got a formula for gradual but serious neurological decline. It's not uncommon for seniors to report that their legs feel like jelly or that they're scared to walk alone because they can't trust their balance. And in many cases, this isn't age decline. It's correctable biochemical imbalance, often rooted in low thiamine. Restoring B1 levels can often lead to quick improvements in coordination, confidence while walking, reduction in cramps, and even mental clarity. Thiamine also interacts synergistically with other nutrients, particularly magnesium and B2 riboflavin, to support proper nerve conduction and energy metabolism. Supplementing with one without the others may lead to limited results. So a whole food B complex or a properly formulated targeted protocol is ideal. For those who are insulin resistant or diabetic, Thiamine also offers protection against advanced glycation end ages, which can damage the nerves and blood vessels in the legs. In fact, research shows that diabetic neuropathy improves significantly when benfotiamine is added to the regimen, often without the need for pain medication. The takeaway here is simple but powerful. You cannot have strong, reliable legs without healthy nerve signals, and you cannot have healthy nerve signals without adequate vitamin B1. It's a foundational nutrient that too many seniors are missing, not because they're neglecting their health, but because the medical system often overlooks it entirely. If your legs are weak, tingly, or tired, and especially if you're on medications or have high blood sugar, then it's time to take thiamine seriously. This one vitamin may be the missing link that restores your balance, energy, and strength, starting from the ground up. Vitamin E is one of those vitamins that rarely gets the spotlight it deserves, especially when it comes to circulation and leg health in seniors. Most people associate vitamin E with skin or eye health, maybe even antioxidant protection. But the truth is, it plays a far more critical role in vascular function, blood flow, and muscle nourishment, particularly in the lower extremities. As we age, blood circulation naturally declines, especially in the legs, feet, and hands. This is due to a variety of factors: arterial stiffening, reduced elasticity of blood vessels, plaque buildup, and diminished mitochondrial efficiency. When circulation slows, nutrients don't reach the tissues as efficiently, oxygen delivery drops, and cellular waste removal becomes sluggish. The result, you start to feel it in your legs: heaviness, fatigue, swelling, cramps, or that pins and needles sensation. This is where vitamin E becomes a game changer. Vitamin E isn't just one compound. It's actually a family of 8 fat-soluble molecules, 4 tocopherols and 4 tocotrienols. Of these, alpha tocopherol is the most biologically active and well-known, but studies show that the tocotriol form may be even more potent when it comes to supporting the cardiovascular system. Vitamin E acts as a powerful antioxidant in the bloodstream, preventing the oxidation of LDL cholesterol, a key step in plaque formation, and keeping the lining of blood vessels, called the endothelium, smooth and functional. In simpler terms, it protects your arteries from damage, keeping blood flow strong and uninterrupted. This is crucial for seniors who may already be dealing with compromised circulation, varicose veins, peripheral artery disease, or diabetes vascular issues. Now let's talk about how vitamin E directly impacts your legs. Blood flow is everything when it comes to leg strength. Muscles don't function in isolation. They rely on a constant supply of oxygen and nutrients to contract, move, and repair themselves. When circulation is weak, your muscles become undernourished, and you may experience soreness, weakness, slow recovery after walking or exercising, and even numbness in the toes. Vitamin E helps dilate blood vessels, reducing platelet aggregation, clumping of blood cells, which lowers the risk of clot formation and keeps the blood moving smoothly. It also supports the flexibility of capillaries, the tiny blood vessels that feed muscles and nerve endings. Without this support, you're looking at stagnation, poor oxygenation, poor performance, and ultimately poor mobility. What's more, vitamin E reduces inflammation, which is often a hidden cause behind poor circulation. Chronic low-grade inflammation thickens blood vessel walls, disrupts endothelial function, and restricts nutrient delivery to the legs and feet. Seniors who experience swelling, fluid retention, or painful joints often don't realize that inflammation is partly to blame, and vitamin E is one of the few natural compounds that directly counteracts inflammatory cytokines in the vascular system. It's also been shown to lower markers of oxidative stress, which means it not only improves how your body functions today, but protects it from deterioration over time. This is particularly important in aging populations where oxidative damage accumulates year by year and weakens the very tissues that keep you standing, moving, and independent. Another overlooked benefit is vitamin E's role in maintaining nerve function, which ties directly to leg coordination and stability. The myelin sheath, the protective layer that insulates nerve fibers, is composed largely of fat, and vitamin E, being fat soluble, helps preserve the integrity of this sheath, ensuring that nerve signals travel smoothly and without interruption. Without it, nerve conduction slows, reflexes lag, and coordination suffers, especially noticeable in seniors who begin to feel off balance or unsure on their feet. This is why vitamin E deficiency is often linked to ataxia, lack of muscle control, muscle weakness, and sensory neuropathy. In many cases, simply restoring vitamin E levels can result in noticeable improvement in gait and leg strength. But it's not just about taking any vitamin E supplement. Many synthetic forms of vitamin E, especially those labeled alga tocopherol, are not well utilized by the body. The natural form, dialga tocopherol, and especially full-spectrum mixed tocopherols and tocotrienols offer superior absorption and broader benefits. Also, because vitamin E is fat-soluble, it should always be taken with food that contains healthy fats to ensure proper absorption. And for those on blood thinners, dosage should be supervised since vitamin E naturally thins the blood and could compound medication effects. But for most seniors, it is not only safe, it's essential. Many seniors unknowingly walk around with low vitamin E levels due to poor absorption, fat malabsorption conditions like gallbladder or liver dysfunction, low fat diets, or simply because they're not consuming the right foods. Good dietary sources include sunflower seeds, almonds, hazelnuts, spinach, and avocados. But even with these, reaching optimal levels is difficult without supplementation. That's why targeted vitamin E, taken in the right form and with the right cofactors like selenium and vitamin C, can dramatically improve blood flow to the legs, reduce risk of clotting, support nerve signaling, and bring vitality back to tired, weak limbs. As the body ages, one of the most silent yet profound shifts that takes place is the decline in nutrient absorption, a process that directly affects everything from muscle strength and energy levels to immune resilience, bone density, and the health of your legs and nerves. What many seniors don't realize is that it's not just about eating the right foods anymore, it's about how well your body can extract and use what you eat. Nutrient absorption is a finely tuned process that begins in the mouth and continues through the stomach, small intestine, liver, pancreas, and beyond. When you're young, this system operates with impressive efficiency. Digestive enzymes flow freely, stomach acid is strong, bile is released on cue. But by the time most people reach their 60s and beyond, this internal machinery starts to slow down, often without obvious symptoms at first. One of the first key changes is a reduction in stomach acid, a condition known as hypochlorhydria. Contrary to popular belief, many digestive problems in older adults like bloating, indigestion, and nutrient malabsorption come from low stomach acid, not too much. Stomach acid is critical for breaking down protein, absorbing minerals like calcium, magnesium, zinc, and iron, and for activating intrinsic factor, the compound needed for vitamin B12 absorption. Without enough acid, food simply sits in the stomach, fermenting rather than digesting, and essential nutrients pass through undigested or underutilized. This becomes especially problematic for energy production and nerve function since nutrients like B12 and iron are vital for oxygen transport, red blood cell formation, and neurotransmitter production. It's no surprise then that seniors with low stomach acid often report fatigue, brain fog, and heaviness in their legs, classic signs of nutrient depletion masquerading as aging. Beyond the stomach, the pancreas also begins to decline in function with age, producing fewer digestive enzymes like lipase for fats, protease for proteins, and amylase for carbs. Without these enzymes, the body cannot break food down into its usable components, amino acids, fatty acids, glucose, and micronutrients. Even if your diet is perfect, the breakdown process is inefficient, leading to deficiencies in fat-soluble vitamins like A, D, E, and K, two nutrients that support everything from bone strength and nerve insulation to inflammation control and blood clot regulation. Vitamin D, for instance, is crucial not just for bones, but for leg strength, immune response, and calcium regulation, and yet the vast majority of seniors are deficient, not only due to reduced sun exposure, but because of poor fat digestion and absorption. Without enzymes and bile acids working efficiently, these key nutrients don't reach the bloodstream where they're needed most. Another factor that impairs nutrient absorption with age is gut inflammation and the degradation of the intestinal lining. Years of exposure to processed foods, toxins, medications, especially NSAIDs and antibiotics, and low-grade infections can wear down the microvilli, the tiny finger-like projections in the small intestine responsible for nutrient uptake. This results in a condition sometimes called leaky gut, where the barrier between your gut and your bloodstream becomes compromised. When this happens, not only does your body absorb fewer nutrients, but it may also absorb things it shouldn't, like undigested food particles or inflammatory proteins, which trigger immune reactions and further damage the gut lining. This chronic inflammation further sabotages absorption and leads to autoimmune issues, joint pain, swelling, and muscle weakness, especially in the lower body where circulation is most vulnerable. Another critical aspect of this equation is medication use, which skyrockets with age. Many commonly prescribed medications such as proton pump inhibitors, PPIs, statins, diuretics, metformin, and certain antibiotics directly deplete essential nutrients or block their absorption. For example, PPIs reduce stomach acid and impair the absorption of B12, calcium, and magnesium. Diuretics cause potassium and magnesium loss through urine, which can lead to cramps, fatigue, and irregular heartbeat. Statins deplete CoQ10, which is crucial for muscle energy, and metformin interferes with B vitamin uptake, especially B12 and folate. What results is a vicious cycle. Medications create deficiencies, deficiencies create symptoms, symptoms lead to more medications, while the root cause, impaired nutrient absorption, is never addressed. Even lifestyle habits such as eating quickly, chronic stress, inadequate chewing, low water intake, and sedentary behavior can weaken digestive fire over time. Stress in particular activates the sympathetic nervous system, fight or flight, which turns off digestion. If you're eating while distracted, anxious, or in a hurry, your body won't prioritize breaking down or absorbing nutrients, no matter how nutrient-dense your food is. Add to that a decline in physical activity, which slows intestinal motility, and you've got a situation where food isn't moving efficiently and nutrients are either trapped or excreted, unused. This is why so many seniors feel like they're eating enough but still experiencing hair thinning, muscle loss, skin changes, brittle nails, or cognitive decline. They're simply not absorbing the building blocks of health. All of this underscores one truth. Aging doesn't have to equal degeneration. But without proper support for digestion and absorption, even the best diet can fall flat. The solution lies not just in what you eat, but in how well your body can digest, absorb, and utilize it, supporting the gut with enzymes, probiotics, fermented foods, and low inflammatory meals, while reducing medication overload and stress can dramatically improve nutrient absorption and reverse many symptoms seniors often blame on just getting older. Because ultimately your legs, your brain, your energy, and your independence are all built on one foundational truth. Your cells are only as healthy as the nutrients they receive. Most people assume that prescription medications are designed to fix a health problem and that once they take the pill, their body will simply get better. But what often goes undiscussed, especially in conventional medicine, is how many of these medications quietly drain the body of essential nutrients, particularly in seniors. As we age, we're already at a disadvantage when it comes to nutrient absorption due to declining stomach acid, enzyme production, and gut integrity. But when you add multiple prescription drugs to the equation, the result is a rapid depletion of vital vitamins, minerals, and cofactors that your body absolutely depends on, not only for energy and healing, but for nerve function, cardiovascular stability, immune resilience, and muscle strength. And it's not just one category of nutrients that gets affected, it's nearly all of them. Depending on the class of medication, one of the most widely prescribed classes, proton pump inhibitors, PPIs, such as omeprazole or pantoprazole, are given to millions of seniors for heartburn and acid reflux. What most people don't know is that these drugs suppress stomach acid production, which might seem helpful short-term, but wreaks havoc long-term. Why? Because stomach acid is required to absorb calcium, magnesium, iron, and especially vitamin B12. With low stomach acid, these nutrients fail to break free from food and remain locked up, unable to be absorbed in the intestines. This leads to bone thinning, muscle cramps, fatigue, anemia, and neurological symptoms like tingling, brain fog, and even depression. And yet, the connection is rarely made between the medication and the downstream deficiency. Another problematic class includes diuretics, often prescribed for high blood pressure, swelling, or heart failure. Common examples include hydrochlorothiazide, furosemide, Lasix, or spironolactone. These drugs act by pushing fluid out of the body, but in doing so, they also cause the urinary loss of essential minerals, particularly potassium, magnesium, sodium, calcium, and zinc. Over time, this can lead to muscle weakness, irregular heartbeat, numbness in the legs or feet, fatigue, and impaired blood sugar regulation. In some cases, diuretic-induced magnesium deficiency can even trigger persistent leg cramps that no amount of stretching or banana eating can fix, because the root cause isn't muscular, it's electrolyte depletion. Then we have statins, the cholesterol-lowering drugs prescribed to millions of people over 50. What these medications do is block an enzyme pathway in the liver to reduce cholesterol. But that same pathway also produces coenzyme Q10, CoQ10, a nutrient your cells need for energy production. CoQ10 is especially important for the heart, brain, and muscles. When statin use depletes this compound, seniors often report fatigue, shortness of breath, memory issues, and muscle pain, a condition known as statin-induced myopathy. Yet most patients are never told that supplementing with CoQ10 can offset this side effect and protect the mitochondria from degeneration. And let's not forget metformin, the frontline drug for type 2 diabetes. While it may help lower blood sugar, it also comes at a cost, depleting vitamin B12 and folate. These two nutrients are critical for red blood cell formation, nerve health, and methylation, a key cellular detox process. B12 deficiency can present subtly at first, fatigue, slight numbness, mood changes, but over time it can lead to irreversible nerve damage, especially in the legs and feet, and that's why diabetic neuropathy is so common. The irony is that the drug intended to control blood sugar may be contributing to the very nerve pain that diabetics are trying to avoid. Antibiotics are another class that, while necessary at times, wreak havoc on gut flora, which is the cornerstone of nutrient absorption. A single round of antibiotics can wipe out large populations of beneficial bacteria, especially bifidobacteria and lactobacillus, which produce B vitamins, vitamin K2, and even help regulate minerals like magnesium. Without these microbes, the gut becomes inflamed, permeable, and less able to absorb nutrients efficiently. Seniors on repeated antibiotic courses often end up with a cascade of problems: digestive issues, weakened immunity, and nutritional anemia. Even antidepressants and anti-anxiety medications have been linked to nutrient depletion. SSRIs, for instance, can interfere with sodium balance and also impact melatonin and magnesium levels, leading to poor sleep and higher stress hormone output. Corticosteroids like prednisone deplete vitamin D, calcium, potassium, and selenium, increasing the risk of osteoporosis, immune suppression, and muscle weakness, especially in the legs. So the picture becomes clear. Medications may help with symptoms in the short term, but they create hidden nutrient deficiencies that lead to new problems. These deficiencies build quietly over months and years, slowly eroding strength, clarity, and resilience. The solution isn't to abandon necessary medications, but rather to become strategic and proactive. Seniors need to understand which nutrients their prescriptions are draining and how to rebuild those reserves through food, supplementation, and lifestyle. Testing micronutrient levels annually, supporting digestion with enzymes or apple cider vinegar, and including highly absorbable forms of supplements like methylated B vitamins, chelated minerals, and fat-soluble vitamins taken with healthy fats. All of this can reverse years of depletion. You must treat nutrient support as a non-negotiable part of aging well, because if you're on meds, you're losing nutrient. And if you're not replacing them, you're giving up energy, mobility, and independence slowly, silently, and unnecessarily. Your body doesn't run on calories alone, it runs on electricity. And that electrical flow depends on very specific vitamins and minerals acting as conductors, gatekeepers, and stabilizers of nerve impulses and muscle contractions. When you think of movement, whether it's a blink, a heartbeat, or lifting your leg out of bed, it's not just a matter of muscles and bones. It's a neuroelectrical process initiated by tiny shifts in voltage across nerve membranes, made possible by ion channels that require vitamins to function. Without these vitamins, the signals become erratic, slow, or entirely blocked. This is why poor vitamin intake, especially in older adults, results in what could best be described as electrical misfiring throughout the body. You don't just feel tired, you feel disconnected, like your limbs are sluggish, your reflexes dull, your balance unstable, and your strength fading without a clear reason. The most immediate example of this breakdown can be seen in the peripheral nervous system, the system that controls sensation and muscle movement in your arms and legs. Here, vitamins like B1, thiamine, B12, methylcobalamin, and B6, pyridoxine, play a direct role in nerve insulation and signal transmission. When your intake of these nutrients is low, either from poor diet, poor absorption, medication use, or chronic stress, your nerve cells begin to degenerate. The myelin sheath, which acts like the plastic insulation on a wire, starts to break down. Without it, electrical signals short circuit or fail to transmit entirely. This results in the familiar symptoms of tingling, numbness, burning, cramping, or weakness, especially in the legs and feet. Seniors often assume this is just aging, but it's more accurate to say it's nutritional nerve damage due to years of suboptimal intake. Vitamin B1, for instance, is critical for converting glucose into energy inside nerve cells, and without it, those cells literally run out of fuel. Thiamine deficiency, even a mild one, can lead to muscle atrophy, coordination problems, and neuropathy. It's not uncommon to see seniors shuffling when they walk, not because of bad joints, but because their nerves aren't firing fast enough to communicate with the muscles. The same goes for vitamin B12, which is essential for DNA synthesis and nerve repair. Here's a silent epidemic going on. Millions of people, especially seniors, are suffering from leg cramps, nerve pain, muscle weakness, fatigue, and even balance problems. And yet the root cause is often overlooked. It's not just aging. It's not just wear and tear. In many cases, it's a vitamin deficiency problem that's slowly developed over years, often unnoticed until the symptoms scream loud enough. The truth is that certain vitamins function like biochemical spark plugs. Without them, your body's electrical system malfunctions, your muscle coordination fails, and your nervous system struggles to transmit signals efficiently. But the encouraging news is that when you restore these specific vitamins, the turnaround can be surprisingly fast. People report better energy, fewer cramps, deeper sleep, improved digestion, sharper cognition, and most importantly, legs that feel stronger, lighter, and more stable. Replenishing these three vitamins, magnesium, vitamin B1, thiamine, and vitamin D, can bring a level of relief that feels like flipping on a switch after years in the dark. Let's start with magnesium, the mineral most people are dangerously low in. But it's not just a mineral. It acts like a vitamin in its function, and it's absolutely essential for over 300 enzymatic processes, many of which are tied directly to muscle relaxation, nerve signaling, and energy production. Without enough magnesium, calcium floods the muscle cells and keeps them contracted, leading to spasms, tightness, twitching, and of course, leg cramps. It also leads to poor sleep, elevated cortisol, and even heart palpitations. Seniors are especially vulnerable because aging kidneys excrete more magnesium, and common medications like diuretics or acid uppers deplete it further. The fastest relief comes from using magnesium glycinate or magnesium malate, which are well absorbed and gentle on digestion. Some people also benefit from topical magnesium sprays or Epsom salt baths, which bypass the gut entirely. Within days of replenishing magnesium, many individuals report leg cramps vanishing completely, better sleep quality, fewer headaches, and an overall calmness in their nervous system that had been missing for years. Next is vitamin B1, or thiamine, one of the most overlooked but most essential vitamins when it comes to nerve health and muscle strength. Thiamine is crucial for converting carbohydrates into usable energy inside the mitochondria. Without it, nerve cells simply can't generate the energy they need to transmit signals, repair damage, or maintain their insulation. What does that feel like? You feel off. You may experience numbness, burning, tingling, weakness in the legs, trouble lifting your feet, foot drop, or even mental fog. Seniors who are chronically low in B1 often get misdiagnosed with neuropathy or early dementia, when in reality their nerves are simply starving for thiamine. The most effective form for fast relief is benfotiamine, a fat-soluble version that crosses the blood-brain barrier and saturates the nerves deeply. Another excellent form is lithiamine, which is derived from garlic and also rapidly absorbed. Replenishing thiamine often brings noticeable improvements in nerve strength, coordination, and energy in just a few days to a week, especially when paired with magnesium, since they work synergistically in electrical conduction across nerve pathways. Then we have vitamin D, the sunshine vitamin, but really it's more of a hormone than a vitamin. Vitamin D regulates calcium transport, immune modulation, and muscle function. Deficiency in D isn't just about bone health. It affects your leg strength, balance, immune function, mood, and inflammation levels. Low levels of vitamin D are directly associated with muscle weakness in the legs and hips, increased fall risk, and delayed recovery after exertion. For seniors, this can be debilitating. And the problem is most people are deficient, even if they spend time in the sun, because skin's ability to convert sunlight into vitamin D decreases with age, and sunscreen blocks it completely. Add to that the lack of dietary sources, few foods naturally contain D, and you have widespread deficiency. The most bioavailable form is vitamin D3, cholecalciferol, and for best results, it should be taken with vitamin K2 to ensure calcium gets directed into the bones and not the artery. Taking 5 to 10,000 IU of D3 with K2, MK7 form has helped many regain muscle strength, reduce inflammation, and even stabilize mood and blood sugar levels. Because D plays a vital role in insulin sensitivity as well. Together, these three, magnesium, B1, and D3, form a nutrient triangle that can rapidly correct the underlying causes of fatigue, weakness, nerve pain, and muscle cramping. They don't just mask the symptoms, they restore the actual electrical balance that runs the body. This is why so many people, especially those over 60, notice dramatic changes within a short time after replenishing these deficiencies. But it's critical to remember that not all supplements are created equal. Bioavailability matters, form matters, timing matters, and if the gut is compromised, you may need support there first, like digestive enzymes or intermittent fasting. To enhance absorption, what you're doing is restoring cellular voltage, and that's what health really is at its core: properly charged, well-fed cells that can communicate, contract, repair, and perform. The key is consistency and awareness, knowing your body is electrical and that these vitamins are the sparks that keep the system alive.